Hey, this is Sandy.
And Randy.
And we're here on AT Corner.
Being an athletic trainer comes with ups and downs, and we're here to showcase them all.
Join us as we share our world in sports medicine.
Welcome back to another episode of AT Corner. For this week's episode, we have a CEU episode discussing the reason why every athletic trainer became an athletic trainer: admin.
You really caught me off guard with that one.
It's funny because I always say that when I'm talking about like the domains of athletic training. And when we get to the admin side, I'm like, this is it. This is why we do it. Paperwork.
Always. I feel like informatics and data is a lot more than that. But I think when you hear it, that's what it sounds like.
For sure. And I think that's the key part is data and informatics. This is probably trying to pull the fun out of paperwork because it can be useful.
Right. So like Randy said, this is a CEU episode and it is good for category A CEUs. Check the show notes down below for more information, but thank you so much to Clinically Pressed and Athletic Training Chat. If this is within our latest 5 episodes, it is free. And if it is not, it is very affordable, along with many others. I think we're close to about 40 CEUs, I want to say.
That's pretty crazy. That's pretty dope.
Yeah, so check those out on the website. And if you have any questions, just email us. Again, all the information is in the show notes.
So for this episode, we're going to describe what informatics is. We're going to discuss how informatics can be utilized within athletic training. And then we'll discuss strategies to improve athletic trainers' use of informatics.
I think, honestly, we have to, because we keep saying the word informatics, but I feel like we really have to start with what is informatics.
Yes, absolutely. So first of all, before we give that actual definition, it's really important to understand there are many different branches of it, right? So it can be a pretty broad area, especially within healthcare in general. For this kind of episode, and especially for athletic trainers, we really will kind of be living in the domain of what's referred to as health informatics and even public health informatics. Health informatics is a field of information science concerned with the management of healthcare data and information through the application of technology. All right, so basically it's using technology to help us process and analyze data.
Which I feel like is very big lately with AI, with the emergence of AI.
Yes, absolutely. And that's really where informatics matters, is how do you apply information? It's not so much about the technology. The technology is a tool, but it's how are you applying this information to like better your practice and so on and so forth. So within healthcare in general, there are plenty of areas when you think about it that generate data points, right? Medical histories, all those fantastic forms that our student athletes and patients love to fill out, right? That could all be data points. Just diagnoses, right? Any kind of diagnosis, lab and imaging results, procedures done, outcome data on just how people are progressing through their pathologies or their return to play. All right, basically, if you can measure it in healthcare, you can probably apply it to informatics.
And like Randy said, like I was really hoping actually you were going to start with this, because after knowing this little piece of information, no pun intended, little data point, I feel like now when I see like generic forms or like injury reports or like random like health screenings or like stuff, or even like our notes, like I think about how if I were to go back and like categorize everyone's data, how it would be so hard to individually pull out information from all those things unless you kind of do that at the beginning. And I think it's going to make more sense when we talk about this.
Yeah, absolutely. And I think that's the important part, is there are limitations to our kind of technology on pulling certain data. And like, again, like informatics is a really large concept, and, we took a couple courses basically on it. So there is a lot going on with it, but really what informatics is about is basically taking all those data points, like we said, in medical histories, the diagnoses, procedures, whatever it is, and being able to analyze it to improve practice or improve like the safety or quality of care. You're trying to basically find kind of relationships and cause and effect of, hey, if I see someone with this, this, and this is what the outcome it leads to, right? It's being able to help kind of make your practice more efficient. But the one thing that is important with informatics and just healthcare data in general is like our healthcare data doesn't really stop and start at the office. Right? Just because they come into the clinic, and they leave, that doesn't mean data stops, right? Really, we as just humans basically create data all the time. We're constantly exposed to environmental factors, socioeconomic factors, right? We have technology now where you can monitor your sleep. You can monitor your heart rate throughout the entire day. Well, basically each second that's monitored, that is a data point, right? And that's kind of that concept of a big data. And like within athletic training, I feel like we don't talk about big data that often or have a lot of access to it just because of the limitations of our EMRs and all that stuff. But you can see that there are still avenues of being able to collect data points, even from an aspect of if you're at an institution or a setting where you have like wearable devices that can help monitor training load. Those are data points being created that could be linked to their healthcare. So that's kind of like the way we can kind of apply that idea of big data within kind of our population is being able to kind of monitor that extra stuff out there, like training load, how long are they working out, how hard was that workout, and stuff like that. So that kind of leads us into, okay, how do we kind of put informatics within athletic training? And kind of like what we kind of talked about with just healthcare in general, right? We as athletic trainers, and I've been telling my students this, we collect a shit ton of data.
Honestly.
Like
without even like trying.
Yeah. When you think about it, we collect a ton of it. And we probably collect more than probably most healthcare offices on a day-to-day basis, I would say.
Because we're also, again, like we said, we're seeing a lot of times in most settings, we're seeing our people every single day.
Yes. Yeah.
Our patients, our athletes. And so even if you're not updating their progress note every day, even if you're updating it every couple of days, like that's going to be more often than your typical healthcare professional. And that's what I'm talking about. Like in the progress notes, like for example, like sportswear, does sportswear allow you to run a report on things targeted in your progress notes? Not yet.
Yeah.
But if you want to run that data, you're going to have to figure out a source to align your notes or align things to make them more harvestable.
Yeah. And that again, it goes back to that technology is a tool. You're kind of limited on to what your technology can kind of pull out. Right. There might be sometimes, like depending on how intense or how in depth you want to get, you might have to do some stuff by hand. Right. But like think of the data that we collect, medical histories. Right. We collect a lot of medical histories.
And everything on there, like think about if you wanted to look at all the blood pressures.
Yes.
Or like how many people have to get their blood pressures redone.
Yeah.
Because there's a ton of people who have to, every single semester.
Previous injury, right? You can pull that data out. Mental health screens, right? If you're at a place that you perform mental health screen, right? That's information.
Which would also be helpful if, like, let's say you're trying to show that you need a mental health professional to come talk to the sport athletes or have someone specific who the sport athletes could come directly to, or that, you don't have any mental health resources on campus and you're trying to show that you need mental health resources on campus. Like, that's what all this data could be used for.
Absolutely. PPEs, right? Trying to calculate the information on what your findings were, what the physician's findings were. Treatment data. I mean, that's kind of a big one. Like holy smokes, we make a lot of treatment data, right? And that could be like even monitoring like the load from your rehab exercises, like the actual accumulation of load and intensity, what treatment worked, right? evaluations, the objective data from our evaluations, right? The list can go on, and we would be here all day if we were going to talk about how much data we actually collect.
Right. And I think that in general, I think people understand that. I think it's now you're going to open your eyes a little bit more to realize like how much is in each, again, like different form, all the different forms we have and stuff like that. You're going to start to notice it.
Yeah. Well, and also too, hopefully seeing it as this stuff might actually be useful instead of just, I just have to get these kids cleared.
Right.
But all this data, kind of like what we're alluding to, can really improve our overall practice and improve the care that we're providing to our patients. We've already kind of talked about some of the examples. You brought up a good one about mental health, right? If you're able to show like, dude, I got like 30% of my athletes coming in with like depression symptoms that could be diagnosed as having depression, we probably need some more help. Give them more resources. So that's a great way that this could be applied and a good idea to kind of start looking at. But this information can help us calculate the value of our service, right? If we're able to calculate our treatments, right? Those treatments do have a value, right? You can just now throw a dollar amount to it and be like, hey, this is how much value I've been able to provide, right? You can collect patient outcomes, right? And compare it to that value and compare it to the treatments, right? That you're doing. What treatments kind of been working? Which ones kind of lead to the best outcomes, right? So you can compare that data. A big one that I really like to use this data for, I do use it a lot for the value part, but I really like looking at trends, especially when it comes to injuries and looking at kind of injury rates, right? So with our data that we're collecting, we could calculate injury risk and injury rate, right? And really to do that, it really wasn't any complex stats or like you really just kind of need an Excel sheet and basically division and multiplication.
Right. And I think that's what's the biggest barrier for a lot of athletic trainers is, like we said, we build a lot of data. I think we just don't really know how to harvest it and what to do with it.
Yeah. Yeah, absolutely. So being able to have a task like that where and it's simple numbers, we already calculate, well, how many people got hurt? How many particular injuries did we see? Right? Well, you can, if you know how long they've been training or how many games or how many practice days or however you want to do it, you can just literally use that information to calculate an injury rate. Right? And what that could be really useful for is it can kind of help kind of guide how to create maybe intervention programs. Right? Instead of just being like, oh my gosh, I got to create all these prevention programs. Well, maybe you can just target like, oh, well, I see a lot of ankle sprains. I'll kind of throw my efforts towards tackling ankle sprains.
So an example of this in real life is with my strength coach. What I did was I looked at all of the injuries that we had. So I have a very extensive because now like data is right. We're like, oh, what do we do with this data? Injury report that I keep on Excel every single day, and I transfer it over to like this long Excel that's basically like I just copy and paste the Excel that I have from each day, and I just put it. So now it's like every single day in one Excel. And so then I can sort it by the date. I could sort it by the person. So I could sort it by the position. I could sort it by the injury. I could sort it by the side. I could sort it by the game status or the practice status. So anyway, it has all, those are just standard things, right, on an injury report. But what I did was with my strength coach, I went in and asked how much effort and how often in attendance they were putting into the weight room. And we looked at that, like we basically went through each person. Of course, my strength coach is also a data nerd. So like it helped a lot, you know, because he was like invested. It wasn't like me like pulling teeth trying to make this happen. But basically like we went through and he gave me like numbers for each person. And it was just literally just me going down the Excel sheet, just adding numbers real quick. And then I was able to run and kind of look at the correlations between the people who were in the weight room more often and the strength or the injury risk, and looking and seeing like, does that affect And then we could use that as we're trying to get like a open a strength position. So now it's like, okay, now we have this correlation that shows that strength, or like having a strength coach do the workouts, is decreasing our injuries. Now we can use this data to show admin and like other things.
Yeah, absolutely. And that goes back to using this information to advocate for more services. That this data too could also help our clinical decision making, right? If you want to get maybe a little more stat heavy, you can kind of look at your evaluation data and like your progress data on like athletes with similar injuries, and you could probably actually create a more personalized prognosis, right? Like if you're like seeing someone who's like, oh well, ankle sprains, if they have this pain on like the 5th day, I've been noticing that like, oh, they return to play at this time, or, they still have this lingering kind of deficit, 2 weeks later, 3 weeks later. So it can help kind of guide your decision-making on when you expect someone to be back.
Mm-hmm.
So now
we talk about this all the time, but like we talk about how in the research, when you're reading literature, it talks about how one intervention works for the majority of people. It doesn't ever talk about how it's worked on 100% of people. And so if you kind of start to look at the literature and figure out like, oh, the literature says that ankle sprains, like Randy's example, ankle sprains on the 5th day, or maybe hamstrings, what I know better. Hamstrings, pain resolves in about a third of the way through rehab. Then you can kind of see, and like part of my doctorate, I put together a hamstring recovery program. And so and that's one of the data points that we use is pain resolves about a third of the way through rehab. So that's part of my return to play criteria. And as I'm monitoring, I'm looking through, and now I have all of these sheets. I haven't gone as far. Now I have all that data. I haven't gone as far as taking that data and actually done something with it to see if it does match the literature, but I have the opportunity to.
Well,
I can take that.
Well, you're building it too, because the more data points you get, the better the model will be that you want. So part of that is just collecting more.
Right. Because really all you would need for that is injury date, and then on there we write their pain and the dates and like when it resolves, and then we have their clearance date. So that's really all I would need for that.
Yeah, no, absolutely. Absolutely.
See, these are things that we are already doing.
Yeah.
It's just shifting your awareness and then just taking one extra step to try to figure out what can I do with the stuff that I'm already doing.
Yeah, because I mean, we already have to record literally pretty much all of this. But now it's being able to now make it a little more useful than just being, well, I just have to record this. I just have to do this.
And it also might just be like recording it in a way that's uniform, or recording it in a way that's a lot easier. Like something that we talked about in our classes is if you're looking at people's pain, like do you write in a note like pain versus do you write discomfort versus do you write something else?
Oh, that's a big one.
And then if you're trying to look for, like, for example, back to that hamstring, pain resolves a third of the way through rehab. Are you looking at, is it easy for you to harvest all of that?
Yeah.
Or do you have to go back and figure out one by one if you wrote pain or discomfort or a different word?
Yeah, no, absolutely. Like the consistency is the key in having a set kind of standard. That makes it easier on your end, because again, if you have multiple different words, now you have to work harder to be like, well, what did I mean there?
Right.
There's a lot of times that happens to me. I'll look back and be like, what did I mean there? What was I doing there? Right? So like, you don't want to make it harder, because again, like, trying to do some of this stuff can sometimes seem daunting. So if you have more barriers in front of you, you're not going to want to. So if you can kind of trim there, make it a little bit easier. So as we talked about collecting all of that data, we now have to look at kind of how we collect that data. So of course we have to talk about the EMR, everybody's favorite, the electronic medical record. And that That's pretty much everyone's favorite thing to do is sit there and document on their EMR.
Just like why we got an athletic trainer.
That's why we do it. But this is where most of our data is collected and stored. And maybe for some places, they may not have an EMR yet. They might still be doing by paper. So that would still be basically what your data collection is. It's just instead of being electronic, it's on paper. But again, now you kind of see the limitation there. It's going to be a lot harder to pull out that data just because now you have to look physically at a bunch of pieces of paper instead of having it all kind of within a system.
Right.
But there's also other electronic resources to keep in mind as well, like Google Forms or Microsoft Forms. Those can help us collect data.
So 2 things. The first thing is I want to just do a little caveat on this because you should really obviously be careful about HIPAA or FERPA or FERPA, depending on what applies. But depending on what your situation is, setting, usually you will be under the umbrella of either, like, let's say your school does Google Suite or it does Microsoft Office. So if it does one of those, usually if they're purchasing like a workplace thing, usually like most of the time they're going to have this thing called a BAA agreement. I think that's what it's called. And that's what protects you and keeps it HIPAA or FERPA or whatever is applying compliant. You got to make sure that your school or institution or wherever your setting is, you got to make sure they have that. Otherwise, you technically shouldn't keep that data unless it's anonymous.
Yeah.
And then the so like for example, like if like my school is under Microsoft, so then I check to make sure that we have a BAA agreement, and then I have to use all Microsoft Excel, even though like I could be better at like Google Forms or like whatever. I can't use that if I'm gonna use like names and injuries, like stuff like that, right? So you just have to kind of be aware of that and check that before you like put all this effort into putting all this stuff.
Correct.
The second thing is we've put together a sign-in sheet on Microsoft Forms, and I've used that to, it has like basic things, and like as we've kind of like tweaked it and kind of like played around with it over the last 3 years, I have included like different things and taken off different things, so then we can kind of again harvest what we need. And then also like you could do it by semester, or you could do it by year, or you could do it like just in general, and you can kind of see. So like we do it by semester, and it's easier to see like, man, we've had a 30% increase of patient interactions this year or this semester versus last year. And why is that? And you can kind of figure that out. And it also helps with like advocating for more help, or you could also see the flow of the room because it's timestamped or like stuff like that. So don't let this data go to waste, I think is one of the biggest things that we're trying to get at.
All right, going back to the BAA, that is very important. What it ensures is, because for it to be HIPAA and FERPA compliant, is it basically keeps the information encrypted from that organization. So if it's Google can't see that information. Or if it's Microsoft can't even see that information. So that's why that BAA is very important. But that is a good point, right? Like, let's not let this data, like we collect this data already, just day to day. Let's be able to actually use it to help our practice. As we talk about that idea of improving our practice, sometimes when we talk about that data collection aspect, it does sometimes seem like it's kind of daunting, because now we're talking like we're using words like, oh, we're collecting data. We're going to run analyses on data. And sometimes that can sound like, whoa, dog. I didn't like stats.
Listen, I didn't like stats, and now data is like a big part of my practice. So
honestly, that's true. Yeah.
I've never liked stats, not a single time that I've taken it. And so don't let that.
I thought we had fun.
One of the two of us.
That's the spirit.
It's not me.
Right. Especially because, again, there seems like we have to document countless things as athletic trainers, and there's even countless reasons why we should document.
Right.
But so I think when we talk about like trying to use informatics and use data for our practice, honestly, I think the most important thing is just to kind of start small. Just kind of do something that's manageable. Right.
Rome wasn't built in a day.
Yeah, exactly. Right. So sometimes it feels like you have to do all this stuff, but like I think just starting small is a really good place to kind of initiate kind of using data within your practice. And honestly, it's better than just like not collecting it at all.
Right.
And I think
or collecting it in an unorganized way that
Yeah.
if you eventually wanted to do something with that data that you couldn't.
yeah, you can't do it. And I think that's a good place to really start looking at maybe using outcome measures. Right, that's a good place to start kind of looking at data and looking at, hey, how are people progressing? Right, what do they look like when they return to play? So with all this emphasis on kind of like being able to collect the data and actually document, there have actually been some literature that's looked at how can we improve documentation for athletic trainers, because our profession is very unique compared to a lot of other healthcare professions. Now, granted, everybody has to document and everyone spends a lot of time documenting, but we also have the caveat that we just don't have a lot of time to do computer things, especially if you're working at like, say, a high school, or if you just work with the sport of football.
Right. Or if you don't have help.
Or if you don't have help, if it's just you, right? It's really hard sometimes to get time to document. And then if you're like having to document everything, right, that's
A lot.
going to be a lot.
Which I think, like, I have the luxury that, like, I do have some time that I could spend on the computer. And so,
Same.
like, this is a little bit more accessible for someone who has access to a computer because it's easier to, like, harvest and gather and export that data.
Absolutely. What's been very surprising is there's really not a lot of guidance on how ATs should and like what we should be documenting. There's other professions have a little bit more, like physical therapy, nursing. They have a little bit more guidance, but for athletic training, it's still kind of vague. Some of this is due to just the different practice acts throughout the country, right? Each state's going to kind of have a little different kind of law on what we should be documenting, especially if you're in a state where, hey, maybe you can bill insurance, right? There's going to be different requirements for that kind of documentation.
That makes sense.
But really the most kind of the current recommendation that I've been able to find was pretty much we need to document anytime athletic training services have been provided. So basically, if you do your job as an athletic trainer, you got to document it.
Right.
There have been some kind of different strategies to kind of help improve documentation. The use of an EMR has been shown to be able to help improve documentation. It's a lot easier. It's more accessible than like maybe paper notes. It's interesting. There are in the literature, some have done like a hybrid approach. Like people have expressed like they do like paper notes and then they transfer them into their EMR.
See, the paper notes are just so accessible. And I know that it's
Yeah.
like so old school, but like,
Sometimes it's easier to write. than
and
to
it's
type.
like, it's so quick rather than like logging in and then clicking the dashboard
Yeah.
and then clicking and then typing the name and then finding their name and then clicking edit and
Yeah.
then clicking their injury and clicking
Yeah.
edit. So like there's a lot of clicking, whereas like
Click fatigue.
I can just click fatigue. I could just like write something down real quick
yeah.
and then like later upload it. You
Yeah,
know,
yeah.
a lot easier.
Which there were quite a few people because like a lot of this literature is like interview based.
Oh, okay.
Like just what ATs are doing and like stuff like that. So it's very qualitative. And that's what, there's a good chunk of people that are like, oh, I do hybrid. I write it down and then I'll put it in my EMR later. Some document.
That's what I do.
Yeah. Some document based on injury severity. And then there's others that document kind of just everything. Right. So it is kind of variable based on how some athletic trainers do it. One strategy that's kind of been advocated for or has been demonstrated to help with documentation is doing the documenting right at the point of care. So that's basically documenting while you're evaluating. So you're documenting while you're doing the evaluation. And that's been shown to save time. I just feel like that's weird.
I think it's weird if you do it in like an abrupt
Got it.
like not paying attention to them
Uh-huh.
way. There will be some times that like I will have my phone
Okay.
and I'll say, hey, I'm just gonna write a little note real quick. Like, I'll say, hey, what happened? And then all I write is the mechanism of
Yeah.
injury down, because that will help me jog my memory
Yeah, for
like
sure.
later. And I write the mechanism of injury and then and I kind of start that note. And then when I sit back down at my computer, then I have all these notes that have been started. So I don't have to remember like who came in and what
Yeah.
happened. And like I already started like the,
Yeah.
you know, the process. Another thing that is helpful too is like if you get all these, like once you start to get these like data collections that like you're making and
Yeah.
they're organized, you can help them like start working together. So like for example, like my in order to do my injury report with all the students, we sit down with the
Yeah.
sign-in sheet.
Yeah.
And so then like we carve out time during the day, right after treatment time, like once the athletes go to their meetings, we literally carve out 15-20 minutes and we all together, all of us go through one by one in the sign-in sheet, who saw this person, who saw this person, who saw this person, what's their update, almost like grand rounds.
Yeah.
Like, you know how they do like the update. And we basically go through and then it also gives the students a chance to like present.
Yeah.
Like, oh, this person's dealing with this and this is what we're doing and this is like our goals and
Nice.
here's what status I think we're going to do. And so then we use the sign-in sheet that again is data, and then we put it on our injury report, which again is data.
Yeah.
And then we can and then also we use that as documentation.
Yeah.
And then all of our notes that can be transferred into our sportswear, EMR, you know, whatever.
Yeah, for sure. I like that. That's dope. Another strategy, and we already kind of talked about this, is creating a standard, like a standardized like process. And this could be your individual practice or just an organization in general. Or if you create like a process that's standard for you or your organization, it becomes routine. Right. So the more you're into your routine, the easier it is to actually be able to document, and you know what you're like, it almost becomes second nature of what you're putting in. Also, if it's an organization, if you're able to create a standard of like, hey, this is how we document here, right? This is just our standard as a workplace, right? You can teach that to other staff members. All right. So being able to like, again, take a new staff member or a newly certified and be like, hey, this is our kind of standard of how we document, our barometer of where you should be at when it comes to documenting. And a lot of it has shown that ATs tend to learn documentation practice from actual like on the job experience. So whether that's maybe as a student with a preceptor or actually going to work in your setting, there's really not a lot of, from what I've seen in the literature, a lot of emphasis within the curriculum as a student to be taught how to document.
Oh, that's funny because I learned how to
Really?
document in my.
I was thinking, I was looking back and I was like, honestly, we didn't really talk about, like we talked about, obviously it's important. And
Did you talk about like what a soap note is?
Yeah, we talked about that. But like, what do you document? When should you document? What needs to be in like the full thing? Like we talked about soap notes, but like we didn't really talk a ton about like
discharge notes,
yeah,
progress notes, and all
yeah,
that.
like the actual layout of your documentation. So yeah, a lot of ATs kind of referenced having to learn it just when they got into their workplace.
I think it's helpful, and I haven't done this yet, but it's something that I've thought about, is I think it'd be really helpful to have like a cookie cutter note that you can kind of copy and paste and then like fill in.
Yeah.
Because I think it would really help like get it started, and also I think that it would help like time efficiency if I could just copy and paste real quick
Yeah.
to get my note going. Also because if you look at like a physical therapy note, it's basically like a worksheet.
Yes.
Like
Yeah.
a lot of it is like written out and then like in bold, and then it's like what the PT types.
Yes.
And then it's like another thing that's like written out and then like what the PT types. And so I think if we look at what other people are doing and what is working for them, I really think that we can kind of make that happen.
Yeah.
I know Core AT has a free EMR, and they harvest data from that to do for research.
Yeah.
And it does have a lot of questions that would be helpful to probably ask while you're doing it.
Yeah.
Because I'm not sure if all of them are questions that you ask like every single person.
Yeah.
But yeah, it's a very thorough EMR that has like a lot that you, and it does standardize it for you.
Yeah, for sure. And that's what I've this past week, I've been working on with sportswear, because you can kind of edit your like drop downs and like pick lists and stuff. For like the evaluate function in the SOAP note, I've actually created one that's range of motion testing, and I've put all the body segments to do range of motion testing. So then I don't have to type in knee flexion active range. I now have it in there, and then I can just type in the degrees.
Oh, that I didn't know. I didn't think about doing that.
Yeah.
I did in my evaluate. I did put swelling, discoloration, ecchymosis, so then I could just type my notes about that.
Yeah.
But did you make it like a separate thing, or did you put it on every single?
No, I made it separate.
Oh, that's smart.
Same, because you can do multiple evaluates.
Oh, see, I didn't think about that.
And then I did one for manual muscle testing too.
Okay, I'm gonna copy you on that.
Yeah. So then if I do it, I just check it to positive because I did it, and then I in the comments put what my findings were. Yeah.
I like
and
that.
I gained that inspiration from, like you said, like PT. It looks like that kind of kind of like
well, that's like the
spit out.
cookie cutter worksheet that I was like talking about.
And I wanted to do that because, again, I think it would save me time. Instead of typing knee flexion, I could just boom, boom, boom.
Well, if you're like me and you lose your train of thought in like every single sentence that you talk, I think that's why like that worksheet kind of like helps. Yeah.
Well, again, it's
also, how many times do you get interrupted while you're doing documentation?
All the time. These kids always need something. Also, too, if you do have paper records, switching to EMR has been shown to be a better way to like improve your documentation as well. But again, I think it's really what works for you. Like, make it your process, right? Whatever it's going to help you document, do it. Yeah. So I do actually have an action item for this one. Like I really specifically thought of an action item for this.
Can I pause you on that action item? Because
I'm really ready. I'm proud of it.
Okay, sweet. Because I want to give it its full attention.
Yeah.
But the paper records that you're talking about, going and switching into like an EMR, I think it doesn't have to be like you have to go away from paper records fully.
Correct.
Because basically, like, let's say for my hamstring example, like the hamstring, I write on there, like I have their just like one paper for them, and like I have their range of motion on there in multiple different tests. I have their like Askling H test. It tells me like if they're ready to return to full speed, and then I have like what percentage of their run sprint progression they're on, what they're doing in their rehab. Like it's all on one sheet, right?
Yeah.
And really from there, like if I were to upload that, right, I can't really harvest anything from like a picture once I scan it, right? But what I can do is, let's say I keep an Excel sheet of like patient 1 or like whatever, hamstring 24.
Yeah.
And then I have like the range of motion, the clearance date, and like how long it took to get like their injury
Yeah.
mechanism, you know? So like, even if I write out specific points, just like real quick as I like when I upload it, then I just write out a couple points and add it to the Excel sheet. Like you don't even have to really think about it. It's just like one extra step that if you know what you want to gather out of it, then you upload it and you never have to think about that piece of paper again.
Yeah.
So like if you want to really get something out of it, if you know what you want to get out of it, you can. It doesn't mean that you don't have to do paper records ever if that's what is easiest.
And even though I use my EMR for everything, I still like for my rehab logs, it's paper.
Right. Exactly.
My return to play testing is on paper.
And you don't have to like, that's what I'm saying.
Yeah,
it's like
exactly.
you don't have to
abandon
it, but you don't have to like transfer it word for like retype every single thing. You only have to retype like the highlights of what you want to get the data on.
Yeah, for sure. For sure.
Okay, action item.
Here we go. So overall, it's important to remember that the analysis that you get out of your data is based on the quality of data that you put in.
Ooh.
Right. So if you put very limited data into your analysis, it's going to give you limited analysis and limited results, right? So just keep that in mind. You get what you kind of get out what you put into it.
Right.
So that's a way to kind of help manage kind of expectations of kind of using informatics and such.
Right. I think also too, like, you have to know your audience and you have to know like what you want to. I think working backwards would be really helpful on this, because like if you know that you want to look at how long an ankle sprain on average for your team takes to return to play, then you know you can be starting to track those things. You know, I this year decided that over the past 3 years, I wanted to take that data and that I already had, right? And I wanted to look at our trends for like the overall number of injuries, the top injuries that we see, and then of course like my hamstring specific data. But I turned this into something like fun. Again, like this doesn't have to be like boring, like on paper, like whatever. I turned this into like a Spotify Wrapped, but for injuries. And I sent it out to my football coaches, and I literally put like the injury data, like some really small bullet points that were like digestible, but for specifics for them to understand, like, man, we were still seeing a lot of hamstring injuries.
Yeah.
Again, sending this over to my strength coach and seeing like, okay, so like this year we had a lot of injuries of, it seemed like we had a lot of injuries, but it's actually because last year's numbers were like down by 20%.
Yeah.
And, you know, this is actually an average number of injuries, you know, or that this year's injuries and last year's and the years before are actually the top three most frequent injuries were the same over the last 3 years. You know, so it's like, man, now we're seeing trends. Now we can actually do something about this.
Yeah, absolutely.
All fun stuff.
All
I feel
good
like it's
stuff.
so limitless.
Honestly, it is. It's a blank canvas when you talk about the data that we collect as athletic trainers, especially in our own practice.
I mean, I think you touched upon it, but like all the data that's also like out, and like we both wear Aura rings, or like how many of your athletes wear a Whoop,
Yeah.
or you know, Apple Watches, like you said.
Yeah. Fitbit.
A Fitbit.
Right, but again, like there's a lot of places that wear those like wearable training devices like the Catapult and stuff like that, you know, you can get that data and now start kind of pairing it with your injury data or even your rehab data.
Yeah, really, really cool stuff if you start to kind of dive deeper into that world.
Yeah, absolutely.
And then just because it's something that we learned in informatics, and I feel like I can't believe we got it through a whole episode without talking about it, but I don't really know where it fits in here, but I have to say, One thing that I learned in informatics was alert fatigue.
There it is. Yes. I was waiting for alert fatigue to come, but we didn't really like talk about like the layout of an EMR. We just mostly talked about, because I feel like that's where alert fatigue comes into play.
Basically, like, you know, when you get a notification like so often, you just start to like ignore it.
Like it automatically just becomes like, yes, I know, whatever.
Yeah. Or like the message that pops up on your computer like all the time that's like, your battery's running low or something. And you're like, okay. And then later, your battery's running low. Okay. Your battery's running low. Okay. And you don't do anything about it.
Yeah, that's alert fatigue.
Yeah. So that's prominent in medicine.
Yeah, because of all the EMRs have like certain alerts when you like trying to make sure like, hey, don't kill your patient.
Hey, don't mix these two medicines.
Yeah, you can't do that. It's like, I know.
Yeah, it doesn't really fit in here, but we did learn about
it. Was in informatics, so
I had to include
and
it.
that was every time we personally talk about informatics, that's what pops up.
That's all the time.
Yeah.
Sweet. Well, I think that's, we did the action item.
Yeah.
You got any more on informatics?
Nope. Okay. I love this stuff.
You really do. You do
love data.
Informatics. Yes. I do too.
You do.
I do.
Do you think you would have been saying that?
No.
While taking informatics?
No. So we do a lot of different kinds of episodes. You know, we could do data on our episodes.
We could.
And which episodes you guys like the most, which episodes we tend to, like which categories we tend to do the most. Mm-hmm. We didn't even talk about AI. You know, there are different, we talk about, there's a lot of like things that are coming out like AI and athletic training.
Yeah.
I think if AI is something that you're interested in exploring, ethically, so instead of like it creating work for you, I think analyzing is a great way to use AI. I think plugging in data and saying like, are there any correlations that I can draw from this, or kind of checking, is it safe to say this? Like I have this data, is it safe for me to pull this conclusion? Kind of like stuff like that, kind of bouncing ideas off of that way and kind of getting some analysis points, or even like how to get some like formula based off that, stuff like that. But yeah, we didn't even touch upon that. But yeah, we could totally run data on our own podcast.
We could. You're right.
So we do a lot of different episodes here on AT Corner. We do CEU episodes like this as part of our education series that Randy heads, where he reads a bunch of different research articles. How many did you read for this one?
I think this one came out. There's not a ton on documentation itself. Probably around 10.
Okay. So those 10 references will be on our website, which is down in the show notes below. We also do story episodes where we bring stories from real life athletic trainers all over the world about a certain topic, and we kind of share each other's experiences and see what it's like to be like an athletic trainer in different ways, and how people have different takes on different topics. We just did burnout, and I think we're going... we haven't done burnout. We're about to do burnout.
Oh, yeah.
So we're working on burnout. That one's going to come out soon. And then we also do highlight interviews where we bring someone, an expert in their field, and we talk about a topic they're an expert in. So we have over 200 episodes that you can peruse through if you're interested. And we also have an Instagram where you can come and chat with us or submit your stories. So I think that's all I have.
Yep. Thank you for helping us showcase athletic training behind the tape. Bye.